Hello, I'm Omar Fawaz, and I'll be introducing the dental implant X Guide for my assignment. For starters, the X Guide is an advanced system that allows the dentist to see specific areas of the mouth with great precision in real time. In other words, the dentist may use the system and software to gather both static and dynamic imagery for increased accuracy. The patented X-point technology enables dentists to focus on singular dynamic points, which can assist in surgical precision and implant placement. Additionally, the X-Guide can make it easier for dentists to perform same-day surgeries when necessary. The defined imagery can eliminate the inconvenient processing delays that often come with other static guides used in dental procedures. Now, this technology offers a lot of advantages to the users. For starters, confident planning. The X-Guide system is compatible with the Cone Beam 3D systems. It uses the X-Guide implant planning software to plan all factors of the ideal implant location. It visualizes the placement of the virtual teeth for better aesthetic planning. And if the dentist is using an intraoral scanner, he can go for a step further with 6 simple clicks, and he can register the intraoral scan to plan an ideal restorative outcome with opposing teeth inclusion. After it is very easy to navigate because the X-point technology makes it easy to look at the screen and concentrate at one dynamic focus point to assist in precisely guiding the surgical implant. Well, the result constantly achieve a more desirable function and aesthetic outcome. Also, the X-Guide system offers an absolute precision. By integrating the Cone Beam 3D imaging with the X-Guide dynamic 3D navigation, the dentist can actually control the exact placement of the implant position, angle, and depth during live surgery. Also, with the X-Guide 3D system, the surgeries can be very precise, safe, and predictable. The surgery times is shorter, and it is generally carried out as flapless surgery and shorter recovery time for the patient. It gives less invasion, blood, and pain for the patient, and immediate loading is possible. Also, monografts can be minimized. But as we all know, with the good comes the bad. Now, the X-Guide system has a lot of advantages, but also has some disadvantages. For starters, it is very expensive to operate. The CT machines is necessary and it's very expensive. Also, when doing a flapless surgery, the patient's bone situation can not be assessed. So if the patient has some weak bone situation, the whole operation can go wrong and it can implicate some serious problems afterwards. Also, the surgery planning time takes longer because of the rendering and the assessing of the situation, of the medical history and of this bone situation and the overall of the patient. Also, the dentist, the user, must learn the planning software, and it's very complicated. And it takes much long time to get used to a whole new system and a whole new software. And any unexpected situations during surgery can be hard to be dealt with, like hemorrhage or cracking or anything related to bone, to the teeth, to the mouth. Also, as we said, it's a very expensive machine, and the surgical kits and surgical templates must be purchased.